you can rely on the images that come out of it. And that's important as you're measuring it. You want to make sure that the images are repeatable every time.
When the patient come to my clinic and they had orthotic before, they always say, well, it's the first time I'm understanding what's my pathology and how I move.
Hi, it's Phil and Fred. Welcome to Modern Footprint, the podcast that is rethinking podiatry and shaping its future.
Welcome to the podcast. So today we're going to talk about the cryovision, and we have a special guest today. Frick and I have a special guest, Nick Watts, which is a general manager at Cryos Technology and a biomechanical engineering. So welcome, guys.
Hey, thanks for having me on. Yeah, as Phil mentioned, I the general manager at Cryos. I graduated biomedical engineering in Australia in 2010 and found my way over into Montreal, Quebec in Canada. And I've been happily with Cryos for the last 10 and a half years or so. And we've seen a lot of changes.
A lot of changes, exactly. So, Frederick, can you tell us a bit what is the cryovision in clinic?
Yeah, well, cryovision is a technology that we've been using for almost 30 years now, that we started to use in clinic because we wanted to make sure that when we're treating patients with orthotics, that the orthotics, what was the change that was happening with the patient wearing it. So it's a system, it's a camera, and I think Nick will be even better than me to explain it. But it's a system that we use when patient comes in. It's part of our evaluation, and then we're able to see the patient coming back after that and make sure and have objective findings to see how the progression, how the evolution of the treatment. So it's really important. And over the last 30 years, we went from a simple camera to a system now. It's all automatic and that we're using every day. So Nick, maybe you can explain us a little bit what's the technology behind the cryovision.
Yeah, so the cryovision imaging system, it's essentially at the heart of it, it's a camera setup with some lights that takes a photo of the patient. It applies a graphic filter on top of the visual images it takes that really highlights any asymmetries in the patient. So in the general setup in your clinics, there's a booth. The patient walks in, stands at one end. The camera system's about 3 meters away from them. The patient normally has their sorry, let's start again. The patient walks into a booth. It's standing about 3 meters away from the camera, and the camera looks at the patient's body. So of course, the more skin it can see, the better.
And there's some lights, and it's some light that's reflecting off the skin.
So it's a very controlled condition, and it's important it's controlled so the results are repeatable. The images are filtered, so you never see the actual visual image of the patient. That's important so they're comfortable with the system, and it creates this graphic filter on top that highlights any asymmetries that are present in the patient's posture. So it's very obvious to see if the patient is leaning to one side, if their knee is tilted forward. Sometimes these things are very obvious to the healthcare professional, yourselves when you see the patient, but for the patient themselves, not so obvious. You tell them to stand straight, and they're tilted to one side. No, stand straight, and they maybe a little straighter, but this is straight for them. This is their normal, but it's creating problems because of that. So as podiatrists, you want to treat that from the ground up. You want to correct their postural imbalance, and having these objective images to share with them to show them that, perhaps their back is sore. Well, their back is sore because their hips are tilted, because their knees rotated forward, because their foot's flat.
Okay.
Throughout the whole postural chain, you can see that effect line up. So in first, it allows you to record their posture at a point in time, say before you've done any treatment, before you've touched them when they're first showing up at the clinic, as well as after you've given them orthotics and follow-up appointments as well. It helps engage them in the conversation of this is this is your pathology and this is why I'm going to treat you like this. It helps have that conversation as well as increase their compliance with the orthotic treatment.
Yeah, what I find in clinic, you're trying to explain something very complicated to the patient, but once they see the picture, all right, they understand then why you what's their position, and then when they come back, like you were saying, you can take the picture again, and you see what the treatment or what the orthotic did to their posture. Is it correct? Is it too much correction? Is it not enough correction? I mean, if they have pain in their knee, well, you can see, well, yeah, you changed too much or you didn't change enough, and then you can do a correction and see again later on how they change.
But that feedback mechanism is really important, I think, for your as a practitioner and as you see patients. How do you gauge yourselves when you're doing an orthotic treatment? You know, how do you look back and say, you know, oh, I remember that patient 6 months ago and their foot was a little flat and their knee was in, but how much was it in? Have you actually corrected it? You know, having that objective feedback to see this is the patient before and this is the patient afterwards. I mean, who's to say you haven't gone too far in your corrections? Yeah.
And I think that you're right. That's the key. That's the objective part of it. That's really important. Is there any caution using it with anybody, or you can use it on everybody?
No, it's a very non-invasive system. So there's no radiation, no ionizing radiation. It's optical lights and cameras. So it can really be used by anyone.
Well, is it heat that you record with the camera?
No, not at all. It's an optical system. So the lights are white light. The cameras picked up their normal optical cameras. The images that it may come across like they're like a thermal image or something like that, but it's just the graphic filter that's added on top. It's a false color image. So it's just transforming the optical image into different colors just to really highlight that asymmetry. So it creates these contours. Okay. And the shape of the contours makes it very easy to compare both sides of the body, the left and the right, to see, you know, if they look different, it's because there's a postural imbalance present.
Okay.
So we can so we can use it on everybody. We can use it when patients wear the orthotics, if they're bare feet, different type of shoes. So you can almost use it in any situation as long as you are in that closed environment to be able to, you know,
and that's an important part of the setup, is having that controlled environment, because it is an optical system. Any stray lighting that comes in can affect it. It'll adjust how the light is reflecting off the patient's body. So it's important to have a closed room and close off that space and dedicate it to this system. But I think once it's installed in the clinic and you've developed the workflow around it, it really captures the patient and involves them in the discussion around why they're feeling sore, why they've come in to see you, what's the reason for this, why do they have a sore back or sore knees, or, you know, what's going on with their feet. You can zoom in down on their lower leg and look at the foot and see how perhaps, you know, if they have a flat foot, how it's curved in, and involve them in that discussion.
Are we able to take the picture only of the feet, or we take the feet, the knees, the whole body? Can you take both?
Yeah, there's two cameras in there. So one is zoomed in on the lower leg. The other one is zoomed out so it can capture the entire body. Sometimes the pathology is just in the lower leg, or maybe you want to capture that in more detail. Other times the postural imbalance, it follows all the way up the chain to the back. So capturing those different viewpoints allows you to make a more informed decision. And you can position the patients as you want. You can have them facing the camera. You can have them facing away. You can get them to lean forward. We've got other people using it in different ways. Other people are putting a bike in front of it and seeing how does it look when the patient's riding on a bike. You know, he's treating people canoeists. What does it look like as they're rowing? You know, how does their posture? So there's many uses for it. We've used it. It's designed specifically for podiatrists, but the possibilities for this are quite large.
How do you use it in your clinic? What would you say is the is your, I would say, your recipe when you have patient coming in. Let's say I'm coming in to see you. What do you do? And over time, how do you use that cryovision technology?
Well, in my clinic, what we do, I'm going to see the patient, what's the problem that they're having, if they have orthotic before, if they had any treatment, or if they had surgery. I mean, if you have a knee surgery, it's going to change dramatically how your knee is going to be positioned. So once I see them, I explain them, then we'll do the picture, and again, I'll look at the picture with them. That's where they're going to realize what I was explaining. It makes sense for them. And then if we do orthotic, or if they have a therapeutic treatment somewhere else, then maybe a month, 2 months, 6 months, a year after that, we can again do the picture, see how they change. And that's where they realize what the orthotic is really making, even if it's pretty small in their shoes. While they see that, oh, my whole body changed since I'm wearing the orthotic. And the same thing happened if they're not wearing the orthotic for a while because it was Christmas or they had a break. Then you can see that last time they were better. Now they're getting not as good as they were before. Or at the same time, when the orthotic wear out, they can see that they're losing the correction that they had before. So it really gives confidence. They have confidence with you that the treatment is going the way you want it to be. So you're not just, when you were using it with orthotic, you're not just selling orthotic. You're really giving an orthotic treatment and make sure that the orthotic is doing what you want. It's exactly like, any treatment. Nobody's changing exactly the way that we think they're going to do. If you have a medication for high blood pressure, an example, well, you need to take the blood pressure again and see is it too low, too high, and then you adjust the medication. Same thing with the orthotic. You do the orthotic, but how the patient's going to change, it's vary a lot.
In your school, were you taught how to do this objective follow-up with your patient? Is that something? Is that a concept
and that's
in
the
the industry at all?
No, and that's the key. It's not done. And I think using a tool like the cryovision help us. It doesn't replace your gait analysis, your physical exam. It's an add-on. But it's an add-on really important, just like Philip just mentioned, that give you more confidence to what you're seeing, and also you're able to explain it to your patient. And I think this is the key, and you can use it even if patient doesn't wear orthotics. That's what's really important. You can use it sometimes people wearing their work boots, is there skates. You could have people standing in front of those cameras and being able to see. And I think that's the key to know. A lot of time when you have new technology, you always ask yourself, what can it do for me? Is it going to help me in my clinic? And I think the cryovision is one of those tools that's going to help you to be a better practitioner, in the sense that you're going to be able to follow your patient better. And like you mentioned earlier, in a way, it's really objective, because it's always nice when patient comes back to see you, say, I feel better. Great. Well, but why you feel better? I don't have pain. So a lot of time we're trying to manage or grade our result in no pain or more pain or less pain, which is okay. We all want our patient to be pain-free, but at the same time want to be able to see what's going on and to have some more prevention. And like you ask, Nick, it's not something we used to do in podiatry, and we're trying to push that a little bit more and more. And having a technology that you can use on everybody, that's there's no caution about it, and it's non-invasive. It's a really great tool for that.
In the school, well, they always say, well, you need to check you need to look at the whole body. But really in practice, well, if you don't have any tool to look what's happening, and like you were saying, Nick, you don't remember how the patient was before. Now you have a tool that is going to allow you to show you if the treatment is going correctly, and to show the patient if why they're getting better. It's not only by chance that their foot is getting better. you can have proof that it changed them.
I guess writing down in your notes can only take it so far when you're looking at the postural position of a whole patient, right? Like you can write down a bit, but 12 months of patients, it's a bit hard to remember exactly what they look like.
Exactly, and even if you put the goniometer on their knee or on their foot, I mean, there's so many error that it's not really reliable. So,
would you is the system reliable in a sense that we can take those pictures over time and make sure that those pictures gonna be reliable and valid?
Yeah, so we've done lots of testing around the reliability, repeatability of the system. In terms of how the light is measured, how the filter's applied, how you can measure angles if you wish to. And we found that it's spot on. There's very, very little variation over time in the system, enough that you can rely on the images that come out of it. And that's important as you're measuring it. You want to make sure that the images are repeatable every time, that you can compare back, over a long period, 6 months, 12 months, over 5 years, and see the progression of the patient. I imagine it must be interesting to see that with children, right? Like you can see as they grow and how their pathologies develop, right?
Yeah, you can see really how the foot is changing with the orthotic. And a lot of time, well, the parent, I mean, they always stay with the kids, so they don't really see the change. But once they see the picture, like 6 months, and now 6 months later, how their foot, how their knee change, it make a big difference. So the parent are a part of the treatment that want the kid to wear the orthotic. But just getting back to the research, I mean, there was research done on the cryovision in the Journal of Ankle and Foot Surgery in 2006, if I'm correct. There was an article, and the University of Montreal was doing a test. The patient was taking a picture, getting out of the booth, getting back on, taking another picture, waiting an hour, doing it in the morning, in the evening, doing 2 weeks later, and they found out that it was very, very repeatable. And when we take the picture in many angles. I mean, from the front, from the back, from the right side, the left side. And if you see an abnormality, you're going to see the same abnormality for all the pictures. So it's true.
Yeah, it's not a fluke in the image.
No, it's not a fluke. Yeah.
Do you think we'll be able in the future to use a system, because now you're using it more static, to use a little bit more dynamic?
Yeah, well, we've as the system's evolved, we've developed the live filter, so it's just an evolution in the programming. So you can see the directly filtered images as you take them, but that opens a possibility for videos as well. I mentioned we have someone using it on people in motion. They're riding a bike. They're doing a paddling motion on a canoe. So we're working on ways to extract that video and make that usable in a clinic setting, and it opens up lots of possibilities to treat the patients with that.
That's great, but thank you. I think it brings us, knowing that where we are, where we were, and knowing that we're able to follow our patient in the evolution of the treatment is really important.
It makes a big difference. I mean, when the patient come to my clinic and they had orthotic before, they always say, well, it's the first time I'm understanding what's my pathology and how I move and what the orthotic is doing. So it's really a completely new experience for the patient, and it makes a big difference for the trust that they get with the patient and the health professional.
And it's a great way, like you mentioned, Phil, that you put, I always like to say, you put yourself as a practitioner a little bit in danger, in the sense that you're measuring what you're telling your patient, and you're telling them this is what's going to happen, and then most of the time, this is what you see. And if you don't see it, then you have to be humble enough to say, oh, but maybe your body is not reacting the way I think it was, and that's okay. That's the way it should be, because we're there to help our patient. If we can use tools like the cryovision, which is part of our all technologies that we use, then in the end, your patient is going to be feeling a lot better, which is what we need. That's what we want. That's really important. And I think if you once again, the listeners, if you want to go on our website, you'll be able to see we have videos showing the images, showing how it is. And it's a really simple way to manage and follow your patient, but a really important way to use.
Well, thank you, Nick. Thank you, Fred. See you next time.
Thanks for having
All
me,
right.
guys.